Hey everybody, this is Dr. Dennis Buckley from Health Advantage Physical Medicine in Pasadena, California. And I'm going to be presenting to you the regenerative medicine revolution. We're going to be talking about the use of stem cells, Wharton's jelly from the umbilical cord and cord blood, and the products that come from there and how they can help regenerate and repair joints to give you better function and a longer life. The Health Advantage Physical Medicine is an integrated clinic. And that means that we have a variety of multidisciplinary practitioners that all work together for your benefit. The way we do that is we base everything on results, getting the optimum results for you, for your condition. The way we do that is an integrated medical team approach. And this includes medical doctor, nurse practitioner, and physician assistant, doctor chiropractic, physical therapist. And we really focus on weight, exercise, and rehab to help you become self-sufficient in your health journey. We also offer services such as weight loss and other wellness services. And like I said, the combination allows us to get the optimum results for your health. Our care has to be safe, it has to be effective, it has to be affordable to help you regain, retain, and optimize your health. So that's what we do. So here's a question for you. Is America healthy? What do you think? Most people say no. And when I do presentations live and I ask this question, the answer comes back no, almost in chorus, in resounding, emphatically say no, America's not healthy. And the reason that is if we look at some of the statistics, maybe it might give us some clues to why America's not healthy. Such as the United States only makes up 5% of the world's population, but we spend more on health than the other 95% of the countries combined. We also consume over 75% of the world's medication. This is Dr. Barbara Stanfield. She's a researcher and department head of health policy and management at Johns Hopkins University. And she published an article in the Journal of the American Medical Association in July of 2000 on the effectiveness of American healthcare. She compared the United States to 16 other countries, and unfortunately, looking at the health of the city's citizens, the United States came in last. So she wondered why. Part of her research discovered some facts that were just kind of astounding, like 225,000 deaths per year in the United States resulted from medical treatment, making medical treatment the number 3 cause of preventable deaths in the U.S. Basically, 106,000 of those deaths came from the side effects of properly prescribed drugs. 80,000 came from hospital-caused infections. 12,000 from unnecessary surgeries that went bad. 7,000 from medication errors. And this is the stunner, 20,000 from other errors in the hospital. You had a great chance of walking into a hospital and not walking out, more than you should have. So she studied this and wondered, well, is that an isolated incident that we came in 16th out of 16? Well, she repeated the study and she compared the U.S. against 16 other nations. And it was a health study about the 17 highest income nations, and they were ranked according to their health in 2013. It compared the U.S. with 16 peer nations, looking at multiple diseases, injuries, and behavior over the entire lifespan. And guess what? Among the 17 countries, the U.S. came in last again. So we're spending a lot of money. A lot of people are dying unnecessarily. There's a lot of drugs being taken, and the health of our citizens is declining. That causes a revolution. So if you think about health, and you think about the process of disease, there's a beginning of the disease and there's an end of the disease. Now, what happens at the end of the disease? Some people may say you die. Some people may say you get better. But when you have a disease timeline, a problem, where do the symptoms of the disease first show up? Most of the time, you'd think maybe they show up at the beginning, so you'll know what's going on. But in most cases, the start of the disease is not the first sign of the symptoms. The symptoms show up near the end of the disease, when it may be too late. An example would be like a heart attack. Many times the first symptom of a heart attack is a heart attack. So One of the things that we deal with in our office is joint inflammation. And that comes from arthritis, it comes from overuse, it comes from injuries, it comes from degeneration, it comes from a lot of different things, autoimmune diseases, lack of use, overuse, you name it. And joint inflammation is the number one thing we see in our office. And that could be in the extremities, and it also could be in the spine. So inflammation of a joint, particularly the soft tissues, can come from a lot of different areas, such as a whiplash injury. It also could come by straining of the neck, muscles, ligaments, tendons through position, like sitting at a computer, or what we have now is called tech neck. So here's what happens. Here's on the left here what a normal spinal joint looks like. You got a disc in between the two bones, and basically there's proper spacing. The disc is properly aligned, the bones are aligned, and this is what a healthy spine looks like. Over time, the discs start to wear out, and the gel in the middle of the disc starts to spread out throughout the fibro outer cartilage. Then it gets into the point where the body starts laying down bones. So that's not on those bones there, that's the lay down of calcium deposits, and it's a reaction to the stress placed on the bone to try to shore it up. And if you notice also, the space between the bones is a lot thinner than the other two, and this basically creates a space compaction where the nerves that exit are having a problem communicating because of the pressure. And then if you see the gel-like symptoms is starting to migrate to the back, this is a herniated disc. And then the last one is phase 3, where the joint starts to fuse together, the discs are gone, there's no space. This is a severe arthritic condition that it hinders activity, it hinders motion, and it creates a lot of problems. So, one of the things that people take when they're in pain is pain medication. So what do they really do? Well, their purpose is to alleviate the pain at the nerve level and the brain spinal cord level, or lower pain-causing inflammation at the site. Makes sense. You hurt, you're in pain, get rid of the pain. However, these drugs do not address the cause of the tissue damage or the inflammation. Thus, the tissue continues to degenerate over time. These drugs do not heal or regenerate anything, and NSAIDs that are very commonly taken, like Aleve and Tylenol, are linked to increase in ulcers, heart attacks, and are responsible for up to 15,000 deaths per year. So, if the pain meds don't work, the next thing people start using is called cortisone. Because meds mask the cause of damage, which leads to progression. Then the cortisone is introduced. Cortisone is used to break down scar tissue that usually accompanies inflamed joints and misaligned joints and damaged joints. Cortisone degrades the bone density and cartilage along with the scar tissue over time. It eventually worsens or speeds up the joint degeneration. It is only temporary and it wears off. It can increase or worsen systemic diseases like diabetes. And it can only be done 4 times because of the fact that it degrades the bone and the cartilage, and so it becomes it does the opposite. Instead of helping the joint, it hurts the joint. So meds such as pain medication and cortisone are masking the cause of damage that leads to progression. Then there's things that people are using, which is called hyaluronic acid injections. These are, the hyaluronic acid is a protein that's bioidentical in the body, and it's obtained from the comb of a rooster. This protein is a natural substance that we make in our bodies to repair cartilage, but when we get older, we don't repair as well, and so you need extra supplies or resources to help with the process. One thing it does not do is it does not grow new cartilage. 3 to 5 injections are approved by the FDA for knees only. It's very safe. It's covered by most insurance plans for knees only. And the hyaluronic acid as lubrication like WD-40, it's only temporary to provide relief. It does buy time and puts off knee surgery. So here's a typical treatment cycle, let's say for a knee inflammation. So you notice you have knee inflammation, so you take some over-the-counter medications. Let's say usually it might get better, it might get worse, it might stay the same, but over time it usually increases in pain. So what you start taking is more NSAIDs or take stronger ones. And if that doesn't work, then usually they take an x-ray of the knee, which then shows the degeneration. Then they recommend a cortisone injection. You have the cortisone injection, which eats away the scar tissue, but then degrades the bone. And then you have the problem again. So then they usually order an MRI. The MRI allows you to see what the x-ray did not show. You can actually look at the soft tissue, the ligaments, the tendons, the cartilage, the meniscus in the knee to see what's damaged. And then they might recommend arthroscopy, which is minimal invasive surgery of the knee to clean out the knee. And if that doesn't work, then they usually do surgery, which is usually a knee replacement. Speaking of surgery, this is an arthroscopy for the knee. There's 3 little holes with the tools in there, so it's minimally invasive and it's highly effective. But there's always a risk of surgery, and it does not address the cause of why the knee is degrading. Knee replacement is much more dramatic, much more complicated. They've got the process down pretty much, but it does cause problems. And another common area for replacement is the hip. So, if drugs are not the answer, and some of the safe stuff is only temporary, and this would include also products like PRP, platelet-rich plasma, which is very effective at reducing pain, but it does not regenerate anything. How do we regenerate joints that are degraded, arthritic, and have worn out? Well, stem cells are being used successfully to repair and regenerate joints. Stem cells are the primary basic cell templates that change to become cells of all tissues, from bones to tendon to glands and organs. A stem cell has the ability to differentiate. It could turn into a muscle cell, it could turn into a skin cell, it could turn into a bone cell, it could turn into a tendon cell, it could turn into an organ cell, a nerve cell, or even other stem cells. The body has the ability to direct these stem cells to change into what they need to be. These stem cells, mesenchymal stem cells, what we're looking at, are the basic connective tissue stem cells that form the framework of organs, nerves, skins, muscles, ligaments, tendon, and cartilage of the whole body. They're present in massive amounts when you're first formed in the womb, and then they differentiate through the signals of the body, through the innate intelligence of the body, to form the organs or the substances that it needs to turn into. The other type of stem cell is known as hematopoietic stem cells, and these are in the cord blood, and they form the red blood cells and white blood cells of your body that are essential for delivering oxygen, taking away waste products, and also fighting infection. The mesenchymal stem cells are rich in a substance called Wharton's jelly. This is a model of the umbilical cord, and the umbilical cord in the middle is where the artery and the vein is, and that's where the cord blood is, and it's surrounded by this substance called Wharton's jelly. So the mesenchymal stem cells are sloughed off from the Wharton's jelly and delivered through the cord blood to the body, where it needs to be into the womb, where the baby needs these cells to basically make new substances such as tendons, ligaments, organs, and bones, etc. The amniotic membrane of the baby and mother is the barrier that protects the baby from the mom's immune system, and Wharton's jelly is the protective layer in the cord. It is the richest source of mesenchymal stem cells in the human body, and these are the ones that we need, that we want, because those are the ones that help regenerate joints and tissues. Now, cord blood is very important also, because that's where the red blood cells and the white blood cells are, but there's other factors in there. There's a rich supply of hematopoietic stem cells in there, and remember, those are the white blood cells and the red blood cells, but it's also loaded with hyaluronic acid. Remember hyaluronic acid? Your body naturally produces it, and they use that as a lubricant in the knee. Well, the hyaluronic acid is very, very important in the development of the fetus. There's also cytokines, which are amino acids that basically signal where the stem cell, where the growth factors, where the protein, where all the things should go. It's kind of the director or the project manager. And there's also growth factors, which creates the body to grow and go on. Research going back over 100 years has shown the benefit of using amniotic fluid. What happened is the basic amniotic membrane. They grafted a preserved amniotic membrane to a burned and ulcerated surfaces, and it was able to regenerate the skin that was needed. So, cord blood, Wharton's jelly, amniotic tissue, where did they come from? Well, first of all, in the commercial production and use in medical office, they're FDA cleared. They're donated by healthy moms after giving a healthy live birth. They're controlled by the placental tissues and fluids that are processed in clean room environments that exceed the American Association of Tissue Bank standards. So the ones we use exceed all the standards that are established, making sure that you're getting exactly what you are purchasing or using. So regenerative tissues are stem cells and tissue building blocks that include growth factor, proteins, collagen, hyaluronic acid, and stem cells. And when injected into an injured area, the theory is that the cells in the regenerative tissues stimulate repair and your body regenerating only what's needed. Basically what we're doing is your body has the ability to heal itself. We're tapping into the body's innate ability to heal itself by providing the body with raw materials and resources that it can use to repair and regenerate. Recent research and clinical literature suggests that cartilage, ligament, tendon, muscle, disc, bone, nerve, etc. all can be regenerated. So here's how the procedure goes. Basically, it's an in-office procedure. It's about a 1-hour procedure. There's no anesthesia, hospital stays, or antibiotics. 0 recovery time. Clinically, we suspect significant improvement in function in 1 to 3 months. And there's minimal adverse effects such as fever, injection site ache, or swelling. We have the stem cells on premise. They're stored in a cryogenic tank. And here are some of the patient stories that have utilized stem cells as an alternative to surgery or other treatments and the results they have. We have a female who's 43 years old, only 43, had debilitating right knee pain, no history of specific trauma, but over the course of 2 years, her knee pain had worsened to the point she's not being able to climb stairs or get out of a car without collapsing in pain. She stopped all exercise for 6 months ago due to pain, and they found that she had ligament tears noted in her knee joint, and she has a history of arthritis. At only 43 years old, she decided to go for stem cells, so she had her day of injection. 1 week later, she was able to run up and down stairs with minimal pain. Remember, she couldn't even go up and down the stairs at all. 4 weeks later, she described her knees as 80% better. She could do squats and almost no pain. And at the end of 2 months, she described her knees as 95% better and was able to return to exercise, pain-free running, squatting, lifting. Basically, she got her life back. Another story is a female, 54-year-old. She works as a physical therapist. She has had debilitating bilateral knee pain. She's had numerous knee dislocations of both knees over 20 times. She was recommended to have arthroscopic surgery at age 22 and a knee replacement in her 40s or 50s. She decided not to go that route, so she did rehab, nutrition, chiropractic care, hyaluronic acid injections, never really solved the problem. So basically for the past 30 years, she could not sit crisscross, wear high heels for more than a couple hours, run at all, and she had difficulty going up and down stairs and could not do a full squat to bend down to pick up things. So she decided to opt for the stem cell protocol, and the day of the injection, started the clock. 1 week after, she had mild inflammation on the knees, which is normal, but she was able to move better. 4 weeks later, she was able to wear heels for a 2-day conference. She was able to do a full squat and get a case of water from the bottom of a shopping cart. And 12 weeks or 3 months later, she described her knees as 95% better. This is after suffering for over 30 years. She started running again. She did pain-free squatting. She said, "It is strange not having anything to bother my knees." So, what does this look like when it regenerates? Well, I'll give you an example. Here's an example, x-ray of normal knees. There's equal spaces between the bones, they're aligned properly, and there's no degeneration. Here's a degenerated knee. You can see there's no space between the bones. The bones are not aligned properly. There's a lot of extra bone in there. This is a severely arthritic knee on the right, and here's the person's on the left. So there's a lot of there's a lot of joint space loss on both sides, and there's a lot of extra bone growth going in there. So Here's some examples of people that have had stem cell therapy. This is July of 2016. A lot of degeneration, and here's what it looked like in April of 2017. So like 8 months later, they had grown back a lot of the cartilage and the space had returned. Not only that, but they were feeling better. This is same thing. I got degeneration of the medial joint space, and now you got more joint space and it's aligned better. This is one where the lateral joint space on the right knee is severely degenerated, and this is what it looks like 2 months later, where there was a lot of improvement very rapidly. This is lateral, medial, and lateral joint space decrease, and this is what it looked like 6 months later. A lot more space in there, and they're feeling and functioning better. Now, so how much does this cost? Well, understand that if you had a knee replacement, it's going to cost about $25,000 to $50,000 plus for a knee replacement, and out of pocket for this procedure is usually $3,000 to about $15,000. Stem cell therapy, or the cost of regenerative medicine, can go anywhere from $5,000 to about $11,000, depending on how many joints are involved, depending on how serious the condition is, and how much that you want to accomplish. So one of the questions that comes up is, do you qualify? One way we find out to qualify is through a history, where we do do an intake and find out about your history, what's going on with you, where's your problem, how long have you had it, what's been done in the past, do you have any other problems going on? So basically what we do is we figure out a way to assess whether or not you would be a good candidate for this. If we find out through the history that you're a good candidate, then we need to do an examination. And after we get your health history, current problems, how it's affecting your current activities, we do an examination. I will have to give a disclaimer right now. At this time, stem cell therapy is not covered by any insurance. It is a cash-only service, and we do offer financing options. But many times the examination, a lot of the physical therapy, and some of the ancillary treatments that need to go along with the stem cell injections are covered by insurance, but that would be determined on an individual basis. So if you are interested to see if you are a good candidate for stem cell, how much it could help you, and also give you all the full disclosure about how much it's going to cost, what you have to look forward to, and the expectations, we invite you to come to our office for a free consultation. That consultation is on us. There's no obligation whatsoever. Call to schedule Health Advantage Physical Medicine at 626-798-7805. And if you do want to proceed and find out through the examination whether or not you are a candidate, because we'll know from the examination about what you will need, we'll do that examination by billing your insurance if you have it. But if you don't have insurance, we'll do it for $49. You can't beat that deal. Free consultation, $49 exam to find out where you're at. No obligation, but I think when you find out where you're at, what you need, and how stem cell can help you, I think you may be more excited about the possibilities of getting your health back, moving forward in your life, and feeling better for as long as you possibly can. We're here to help. Let us know how we can help. This is Dr. Buckley.